Okay, so the first thing, of course, is to welcome you to our student conference this morning. And we have such a wonderful guest speaker list for you to be thinking about all the different things associated with early years education, childcare, caring and educating for our babies and young children. And we have guest speakers including Breda Hyde, and Breda has actually sent some slides along that I'm going to take you through. And also let's look at our list of wonderful things. We have Helen Simmons from the University of Northamptonshire, who's going to be talking to us about infant and family mental health and wellbeing, and also what's available at Northampton University for students progressing from qualifications in early years in education. We have Jack Edwards from Swift, and Jack's going to talk to us about the gender situation and enlighten us around apprenticeships and all things early years. We also welcome Karen Chetwood from the Montessori International. Alana, can I help you? You've got your hand raised. Are you okay? Okay. And we have, so we'll talk about all things Montessori. And we're also going to welcome the City of Bristol College, Charlotte Condon, who will be joined by two of her students, Dolce and Emily, and they will represent the student voice. And then if we have chance, because we've got a pre-recording at 11:45 there, Whiskers, Wags and Wellbeing, and I know that's probably captured your imagination. What on earth is that about? And that's looking at animal and animal therapy. So if we get a chance, we'll listen to that together. If not, that will be sent on as a recording that you can listen to, because it would be a shame to cut that short as well. Okay, so my name's Janet King. I'm the Sector Manager for Education and Childcare here at NCFE, and I'm joined by colleagues today. So we have Angie Rogers, who's our subject chair in early years. So morning, Ange.
Morning, everybody. Please encourage you to use the chat box. I know some of you have, and it's been fantastic to see how many students you've got attending. So please carry on using that. I will be monitoring that as we go through. So please do use the chat. Thank you.
Thanks, Angela. And we also have Laura and Kay, who are working like swans in the background, making sure that everything is going to plan from a technical point of view. So thank you very much to Laura and Kay as well. And any other NCFE colleagues that are on the call, thank you for your support. Staff and students in education in early years, this is for you. And you can see from the agenda there that we have a packed and wonderful session for you today. Now, Breda couldn't be with us today because her role as a certified play therapist, a qualified play therapist, is something that is very involved and something that actually means she's extremely busy, and she wasn't able to join us, but she did develop some slides for us, and so I just want to sort of talk you through these. So she's a certified play therapist, but she started her journey sort of quite late in her life, knew that she wanted to work with children, and there she is in her wonderful playroom. Who wouldn't want to be in Breda's playroom? It certainly looks full of curious things, doesn't it? Very, very interesting. But she started her level 3 early years qualification, and she won't mind me saying she started in her late 40s, and she's gone on to do amazing things. And so this is her way really of saying, my journey, Breda's journey, has given her the opportunity to do something and to follow her dreams and to look at play therapy as an option for you as you are going through and you're thinking about your career. And she just wanted to put a little bit of a spotlight onto her journey and what she's done so far, but also giving you an understanding and a grounding as students in terms of what does play therapy mean, and why is it so interesting, and why Breda has found it such an inspirational journey for herself. So Following her level 3 early years qualification, she went on to do a diploma in counselling for children and young people. She did a degree in education and then a postgraduate course. So she stayed on and did a little bit more study to be able to qualify as a play therapist. She's worked in nursery, primary and secondary schools, and she's currently self-employed as a play therapist, working in schools and in private practice. So these are the things that have influenced Breda. I knew I wanted to work with children. I only knew in which role once I worked across the sector. I soon realised that I wanted to work with children who needed support. I asked Breda about what her day was like. She said, "Oh, there's no such thing. There's no typical day, but it will always be a privilege to work with children in a non-judgmental way. I learned so much from the children." One of her key phrases that she used when we were chatting was, "Don't rescue, you nurture. You help children by validating their feelings, sharing their feelings. Do not disguise it or pretend it is not there." So as a play therapist, she's really trying to understand and to say, "I can see you're angry, I can see you're upset," and taking that time to be able to validate that it's okay to feel like that and to understand that, and not to disguise it or dismiss that as an invalid feeling. The key features of the work of the play therapist is to build relationships with children, to establish and maintain those connections. And you will know, working with babies and children, the importance of relationships, the importance of making that really strong connection with children. Listening to children, really hearing them, seeing them, and understanding them. Respecting the uniqueness of every child. And you'll learn about that, won't you? When you look at the early years foundation stage, you'll see that that's one of those principles, and the uniqueness of every child is at the core of everything that you do, making sure that everything you do is in the best interest of that child. Again, validating their feelings. Don't try to disguise or extinguish. Allow children to show their feelings. And this is an interesting comment. Children borrow tools of regulation from the adult. So always remember, how do I feel? Regulate yourself before you can support and co-regulate others. And when we think about regulation and regulating ourselves, we're just thinking, do I feel okay? Am I agitated today? Am I restless? Is there something on my mind? Can I actually be the early years practitioner today? And let's get myself into that calm phase and feeling calm to be able to support and co-regulate, help the children to be able to recognize, manage and deal with their own feelings. Remembering that that behavior is telling us something. Let's look beyond the behavior and try to explore the needs of the child to really understand and validate what's happening in their lives. So the children that may access play therapy with Breda may exhibit behaviour that does not conform to social norms. There may be communication problems. She's seen a rise in anxiety since COVID, especially amongst teenage girls who don't feel safe at school. Masking emotions at school, so hiding their emotions. Everything's okay. And then suddenly after school or in the in the home environment or in that personal space, they're unable to express their emotions. Pathological demand avoidance, so not being able to conform and unable to self-regulate. So all of these things will give rise to that restless behavior. So asked about the challenges that she may feel in her work. Well, Jana, we have to admit that we can't help everyone. Things don't always go to plan. We have to try, we have to do our best, we have to work with others sometimes. It takes time, and collaborated ways of working make a difference. Therapy can be challenging for children. It's not a reward. So when we look at that wonderful play environment, we've always got to remember that children are coming here who may have experienced some sort of trauma, who are not able to regulate their feelings, who are feeling angry, sad, lonely, all of these things. And that actually it's not a reward, but it can be challenging and very exhausting for children to go through play therapy. The highlights for Breda was that she saw this as an absolute privilege, that she helped to restore a sense of calm, bringing calm to the chaos, very important. The focus on the feelings and the validation of feelings, she said that many times, and building that relationship, as you will know from your placement experiences, or if you're listening to this as an employee, you will know the importance of making those strong connections. So when she was wrapping up and reflecting what the sorts of things that Breda said is, it's never too late to train, follow your passion. Remember, Breda didn't start her training until she was in her 40s. She won't mind me saying that because she's very proud of what she's achieved. She didn't know what sort of work she wanted to do with children and young people. She just knew she wanted to work with children. So she started with that level 3 diploma, like many of you are doing, whether that's a T level 3 diploma, a level 2 diploma, or a level 1 diploma, to be able to progress, whatever it is that you're doing. Or you may be working on a childcare qualification that looks at assisting teaching. All of these qualifications at level 3 will give you that foundation to be able to think about this as an option. And Breda was very keen that you knew about this field of work, because it isn't often something that you see or hear about. Know what you want to be remembered for. Be that person who listened enough to care and care enough to listen. Let's just read that one again. So when you're working with babies, children and their families and young people, know what you want to be remembered for. So think about the kind of person that a childcare practitioner should be remembered for. Make that you and be that person. Listen to those children. Listen enough to care. And remember to care enough to listen. In such a busy environment, so we sometimes need to remind ourselves of that. I think that was quite a prominent thing, so we kept that on the slide. Okay, I'm just going to pause there to see if any questions have been added to the chat. So Angie, over to you.
Morning. Oh, so
Morning.
lovely. I've just been busy putting all hearts, and I'm hoping I haven't missed anybody out. It's so lovely to see so many of you. No questions at the moment, Janet. But can I just say our audience is very diverse, and it's great to see so many of you from various different backgrounds. And Janet, can I just say, wow, that was amazing to hear all about her. I mean, I think the work that she does is incredible, and her journey is inspirational. So yeah, absolutely amazing.
It really, really is. And I think sometimes we don't, we only know what we know. And working in early years, and of course, Breda herself, before she became a play therapist, worked in early years for a long time. So it could be that we're working as a teaching assistant. It could be that we're working as an early years educator, level 2, level 3, and then think, okay, I want to do something else, but you're not sure what. And if that sort of social care, that sort of what's the word, intervention role maybe is something that appeals to you, then play therapy is something that perhaps you could consider. So it's good to put that one out on the radar. Okay, so I'm just going to check with staff that we have Helen with us.
Helen is here.
Hey,
Hey, Janet.
brilliant. Morning, Helen. Sorry, I
Morning.
can't see the screen. I can
That's
just see
okay.
the presentation, but great to have you. So, we are running a little bit early, which is unusual for me. So, let's keep it that way. So, it is my absolute pleasure to welcome Helen from the University of Northampton. So, I just want to say a little bit about Helen's amazing journey, and I know Helen, you perhaps will talk a little bit about this yourself. But you can see from the slide there that Helen is a course leader for the Masters in Infant and Family Mental Health and Wellbeing at Northampton. She's a senior lecturer in education, childhood, youth, and families. She's the co-lead for the Families and Community Special Interest Group, co-chair of the EDI Staff Network for Parents and Carers, Equality, Diversity and Inclusion, has over 20 years experience in further and higher education, following earlier work in early childhood settings and as a private nanny. She's the Vice Chair, Policy Lobbying and Advocacy for national and international of the Early Childhood Studies Degrees Network, and a Senior Fellow of the Higher Education Academy. I don't know how you manage all this, Helen. And she's the trustee board member of the Association of Infant Mental Health and Wellbeing. It's absolutely incredible that you've been able to join us this morning, Helen. And so over to you. And just give me the nod when you want me to move on.
Oh, will do. Thank you, Janet, and thank you for having me this morning. I really appreciate it. So, morning, everybody, and it's really lovely to be here. And I've been looking at the chat and things, so hopefully you'll enjoy sort of hearing from me this morning. So, yeah, as Janet said, I'm Helen Simmons, and I was asked to just give a little bit of sort of background, just to begin with, around my sort of career journey and leading into kind of my day-to-day work as well. So, which always feels a bit self-indulgent, doesn't it, to kind of do that? But I think one thing that's really important, particularly in our sector, is to tell our stories and to hear all about our own roots into kind of what we do now, which is different for everybody. So for me, I sort of, I suppose, thinking back to school days, I didn't find school particularly easy. I was premature, I'm a twin, and I think probably should have been held back a year on reflection, but or should have been born the following academic year, really. So I always just felt a sense of panic at school. That was the overriding feeling I remember of being a child until really much later on, when things started to kind of click around taking different A levels and things. GCSEs didn't go great for me. I speak to students a lot about the dreaded maths GCSE and some of the challenges that brought for me, which is really familiar. It took me several goes. And then I fell into a degree called Early Childhood Studies, which was really new at the time. I thought I'd wanted to be a primary school teacher all my life. I'd always been the child setting up the teddies and doing the register and all of that. And I thought I would be a primary school teacher, and that just became something that wasn't an option for me because of how my school experience had been, and also my GCSEs. I knew I could use my degree as a route into teaching. But then actually, when I started my early childhood studies degree in Liverpool in 1998, I suddenly had this kind of brand new insight of information, which was, yeah, education is really important for a child and looking at their education experiences, but there's also so much that's happening in their lives, within society, within their communities. So I started to become interested in psychology and sociology and history and so many other aspects that kind of brought this richness, but always with the child at the centre. And that's really what has driven me ever since, kind of that understanding of childhood from so many different angles, in so many different countries at different times. And that's really sort of, you know, how my sort of career started, really, with different placements. And after university, I became a nanny and worked in nurseries, and was really, I loved working particularly in the baby room. I always felt that was kind of my comfort zone, kind of working with very young children, but also interacting with families and supporting parents and just hearing about their experiences. So after some time in practice, I decided actually I'm really interested in the theory behind early childhood and all the different perspectives and how our understandings changed and how society changes how we view children and view childhood and the politics around all of that as well. So I went back to university and did a PGCE in post-compulsory education, not primary teaching, but teaching early years vocational programs, cash and BTEC in colleges and sixth form colleges, which I did for several years and absolutely loved. You know, I think the programs from entry level all the way up to level 4 just provide such a richness of information around, again, theories, but theories that challenge each other. So not coming from a rigid perspective of development theory or milestones, but using and engaging with all of that, but also thinking about, well, what happens when that doesn't suit a child or a child doesn't fit into a particular model, and how do we support them in a way that's not changing the child, but actually changing the system as well. So, and then eventually moved into higher education, started my career in higher education at the University of Derby, was a programme leader for early childhood studies and the Masters in Education, the early years pathway. Absolutely loved, again, just loved meeting students, meeting colleagues from a range of different professional backgrounds, and started to become interested in taking my research further, which was really focused on parenting, actually, and based on my own experiences as a nanny, but also of becoming a mother myself, and have really focused on motherhood and a lot of the challenges that mothers face, particularly around things like social media and lots of ideologies of motherhood and how that impacts on experiences. And eventually that work brought me to the University of Northampton. This is my 4th academic year at Northampton, and I've met some amazing people. Professor Eunice Lumsden, who's a professor of child advocacy, is really the first person I knew, and also Tanya Richardson and Michelle, who's here today. And just you know, I think what's really lovely about degrees like ours, which I'm coming on to, is we have all come from such different professional backgrounds, whether it's social work or education or working in early year settings or in policy or in nursing, but what we all have in common is our focus on children and families and on supporting them in the best way possible, to hear their voices, to provide respectful support, which isn't always the case, as we know. So yeah, that's where I am now, that we've just validated and started. Actually, it's really exciting. It's the 3rd week of the Masters programme. We've got an amazing cohort of students from, again, early childhood, health, policy. We have some students who are foster carers, adopters, and really just what that brings is such a rich opportunity to share stories. Again, that's what it always comes down to for me, to hear about people's stories, about people's lives, and use all of that knowledge and richness to inform policy, not the other way around. So that's really kind of me in a nutshell. A few other things, and love kind of working in policy. Because I think, as I come on to now, it's important to have a seat at the table, because it's easy sometimes to be cynical, and we all have our own reasons for that and our own experiences which are challenging. But I think to inform and to lobby and to advocate for children and families is really, really important. And that runs through our subject area, our school, which is the School of Education and Society at the University of Northampton, with a mission statement that really encompasses our values, which is about reflexive, a self-directed community of learners that challenge inequity and empower change. It's about learning about childhood, learning about families, but using that as a way to really hold up a mirror to ourselves and think about, what are we doing? How are we making a change? You know, what are our assumptions? What are our value bases? And how has our childhood informed that? And how do we move forward with all of that in a really productive, positive way for children? So we've got the next slide, which gives you a little bit of an overview of some of the undergraduate programs, which hopefully lots of you will be interested in hearing about. And then I'll talk a little bit about the masters as well, but really with a golden thread that runs through all of that, which is the people that deliver these programs. We all teach across programs, which is really lovely and quite unique, that we're not within sort of silo working environments. We all teach across a suite of programs, which means that the students that come onto them really get our expertise. So I tend to deliver things that are focused on the family and on the workforce as well, and really that promotion of a critically reflective workforce that is supported to be the best that it can be. So I won't go into loads of detail. You can find information on the website, but just to give you sort of a bit of an overview, you've got 4 programs here within the subject area within the school. There are lots more as well, but I thought, you know, these would be the ones that would really kind of stand out for you. So the first one at the top here is actually a level 6 program. It's a top up, which Michelle Bugby, who I've just seen in the chat, led the development of this program, and it's a really amazing level 6 program. So for practitioners and students who have done a foundation degree or have a level 5 qualification, they can come onto this, and it's an online distance learning program and top up their work to become a full BA Honours degree in early years, childhood and family studies. So it's a really lovely holistic program which focuses on aspects of supporting families and communities, and it's got that research informed focus as well, so students actually being able to engage in some research within their own practice. And the other thing that kind of runs through everything, I would say, is that action. You know, I think one thing that I always felt at university was I love all the theories, I love hearing about the history, but what are we going to do with that? How are we going to inform practice? How are we going to make changes? It has to be for something, and you have to see, even if it's, you know, only the kind of a tiny ripple, you have to be able to see that change happening. And I think that's really embedded into our programs. We have an undergraduate degree, which is working with children, young people and families, which focuses on childhood and families from sort of naught, lifelong really, because it includes the family. So it's actually thinking about the importance of attachment and early relationships, but also how we support parents within that, how we support mental health, and also extended family. So thinking about grandparents and so on, and that, you know, the kind of community support as well. Early childhood studies, which is a program which is looking at the holistic development really, so thinking about lots of different aspects of development for children, but also kind of reflecting on, again, the workforce and how we can work together to sort of advocate for children, and think about how all of those theories can support learning in lots of different ways. And education studies, which brings in sort of international perspectives and looking at how children experience education in different countries, and different philosophical approaches as well. Okay, moving on to the masters. So we were really keen. We started the postgraduate certificate in advanced practice in infant mental health and well-being about 3 years ago, and I was fortunate enough to be on the validation panel for that. So when we started having conversations with the students on that, they all said, we'd love this to be a full masters. Is there any way that we can bring it and build it and it become a master's qualification, a level 7 qualification? And that's what we did. So we spoke to students, we spoke to stakeholders, employers, and a lot of us on the program are, as I said, involved in kind of policy development, and we saw policy changing with the Best Start for Life initiative and the Best Start family hubs, and now with the 1001 Days Foundation, real focus on perinatal mental health, but also parenting, early relationships, and again, that support for an empowered workforce and interprofessional workforce. And that's really what the masters is. It's bringing lots of voices together to think about how are we working together? Are there any missed opportunities? And how can we sort of feed in the experiences of parents in a really kind of productive way? So again, it's that collaboration. So it's an online program. You can take it full time or part time, and you can choose a pathway within it. So we have an infant centred specialism and a family centred specialism as well. So what that tends to look like is in relation to people's experiences within practice. So we have a lot of early childhood graduates on the programme at the moment who are really focusing on children's voices, children's rights, and how all of that is embedded into practice. And some of the students are taking the family-centred approach, which obviously the two can't be separated out. They are sort of taught together because we recognise that is a thread that kind of is needed to go through both. But the family-centred specialism tends to focus on things like transitions to parenting, looking at generational experiences, looking at support and policy and how that positions families, and again thinking about that kind of embedded support. So there is a QR code on the next slide, which you can have a, oh sorry, that's not on this version. So it's okay, I can put it into the chat afterwards because I've just noticed some of the questions about information about finance and about the qualification. So afterwards I'll put it into the chat so you can follow the link through. This just gives you some information from the website about the course itself and how it aligns to current policy like the Manifesto for Babies, and how it also is supported by the Association of Infant Mental Health, because embedded into the programme is a membership for AIM with loads of workshops and links to different things that you can get involved with. Again, it's about that sort of theory in practice and working with families and working with different organisations. I spend a lot of my time supporting a community interest company called Connected Perinatal, which is an amazing organisation that supports parents, new parents, in an area of Derby. And actually it's volunteers, it's peer support, it's about lived experience. And what we often find is that that's the most meaningful support, isn't it? When people have had that lived experience and can support families in a way that's relevant and representative for them, rather than anything that's too sort of top down. So just to kind of wrap up, there's some key facts on the next slide. And just to answer Abigail's question there, yes, so with the MA, when we validated this, because we recognise all of the experience that people have who come onto the course, but that can be in a really wide field. Absolutely. So essentially what I'm saying there is just get in touch and we'll have a conversation about that, because it's not a kind of one size fits all with the admissions process, because we really take into account people's lived experience and qualifications and different routes as well. So yeah, really open to having a chat about that. So yeah, you can take it full-time, part-time. It is aimed at practitioners, but we're finding with this cohort, it's really varied. You know, people have come from their own personal experience, as I mentioned, kind of working and supporting children as a foster carer, right through to have people having their own early years settings, or working in as actually building early years qualifications. And then also we've got children's nurses on there, and really social work and kind of real policy background, but really rich, varied conversations. But it is 100% online. We do recognise that people are working full time a lot of the time who come onto this programme, so we run it in the evening, so it's really sort of manageable within that. And I think ultimately the kind of key, as I've mentioned on the podcast that Janet had me on recently, the main thing with all of this, the next slide is fine, Janet, actually, because that kind of wraps up with some links there as well. Thanks. Is again, just to kind of reinforce, it's about the team. It's about the team that deliver these programs. What we have is a really collaborative. We don't all come from the same professional backgrounds. We don't come from the same academic disciplines. And so we do have lots of debate and conversation. And that's what we encourage with our students as well, because we can't move forward if we all think the same. So we recognise that it's about driving forward research. We're all involved in research and publications, being involved in our different networks. And so really kind of taking all of that knowledge, but putting it into practice, and that knowledge exchange as well. So there's a few links there to open days, but you can always just kind of contact me. We'd always love having a conversation and sharing. I'll put a couple of links in the chat as well, but if anyone's got any questions for me now or for another time. But yeah, thank you for listening to me.
Thank you, Helen. That was absolutely amazing, as I knew it would be. And I think when we think about all those different options, it might feel a little bit overwhelming. But for me, what it absolutely means for us as a student community here, we can just think there's going to be something for everybody, so something that might appeal to everybody. And it's just good to see and exciting to see what your journey's been like, and the different options that are available for students. And you may be listening now to this conference and thinking, I want to enter the world of work, I don't want to go to university, or you might be thinking, I'm really excited about going on to university. And what this actually means is that there's no rush for this journey. This absolutely is something where you know what the opportunities are, where you can see what your next step might be, and that actually sometimes it's good to have a little bit of experience in industry and then progress. Or you might think, I'm really eager to learn more. I want to take that next step straight away. So I think it's just great to hear what the University of Northampton is offering in terms of, those different opportunities for students at whatever sort of level they might be at. So it could be that we're talking to people who've worked their way up to a level 3, a level 4, a level 5. And they're going on to do a top-up online. What a fantastic opportunity. Or they may go straight from school or college to university, and there are options there. And then, of course, options to come back and to get some more, I suppose, professional development in terms of the master's degrees there. So, Helen, thank you so much for sharing all of that. And I'm sure you'll have got everybody thinking, and certainly staff as well who are listening, and the different options and the different routes that are available to that professional development. Thank you so much. I'm just going to ask Angie, who's been looking at the chat, if there, although Helen, you've done a brilliant job there of keeping on top of the questions as they arose. But is there anything else or anything that you'd like to add or ask, Angie, at this moment?
Yeah, just first of all, again, just amazing. And it's that journey, I think, is absolutely brilliant. And the opportunities that you've explained to us and exposed to us, I think that's amazing. I think it's really important to highlight that. There are a lot of students on our event today, so it's great. One question, this is from Alicia. She wants to know that, do you also focus on families' experiences with social work in the MA?
Yes, yeah, absolutely, we do, and that's really the key, because we try and, within all of our teaching, although it's probably not clear today because I've just spoken, but actually what we really try and do in our lectures and in our seminars and whatnot is have conversation. That's the key. Like I said at the start, it's about people's stories, people's experiences, and we're only going to learn from that if we hear from each other. So yeah, it's about people's personal experiences, which brings a lot of people onto programs like ours, within early childhood and within infants and family mental health. Often there are threads that, or kind of, if you look back, you kind of peel away all the different layers. There are reasons that people come onto programs like this, like all of us. And so it's about having those conversations in a really safe and respectful way as well. People are entitled to their privacy and don't always want to share things. But I think as people get to know us better, and also as we kind of, develop those relationships, people are really honest and open about exploring that. And I think that can only ever add to richness in practice as well. Lived experience and people's lives ultimately is kind of what it's all about, isn't it?
Absolutely. I think that really answers those questions for her. And yeah, you're absolutely right. I think it all entwines itself, doesn't it? And I think that's brilliant. Well done.
Thank you.
Okay, thank you. Thanks, Helen. Just going to move on now to introduce Jack. So, hi, Jack. Jack is the Operations Director at Swift, and he's overseeing the organisation's educational strategy and ensures high-quality apprenticeship and training programmes. He actively engages in professional development and industry advocacy to enhance the quality and visibility of Swift's educational initiatives. And we'll hear a little bit more about Swift and what that is and what that means. Jack plays a key role in promoting early childhood education and the professional growth of apprenticeships. He's obviously, as you can see, an absolutely strong advocate for apprenticeships and increasing male representation in the early years sector. And there's a lot going on in that area at the moment in terms of incentives for those joining the early years. I'd just like to remind people if they can go on mute, that would be great if you're not actually speaking at the moment. And then works to challenge stereotypes and highlight the value of a diverse workforce in supporting children's development. And I know this to be true. He's dedicated to creating high quality supportive training programs that equip apprentices with the knowledge, skills and practical experiences needed for career success. So, Jack, welcome. Thank you very much for joining us. And over to you.
Yeah, brilliant. Hi, everyone. I have been keeping an eye on the chat, and it's great actually to see so many students here, whether you're beginning your career in early years, whether you've just started qualification or you're already enrolled. I think it's always good to keep on top of your CPD. So for us today, what I'm going to be going through who we are at Swift, what we offer, but also our intention. There's lots of different training providers out there, and really I just want to get across the message of what you're training providers should be providing to you, and what you should be looking out for an apprenticeship as well. And I'm also going to be talking around gender inclusivity and just raising that profile and excellence. So if I start off firstly with who we are, so we've been supporting childcare professionals since 2012. We are really proud to be an award-winning training provider. So we recently won Nationwide Childcare Training Provider of the Year, and we've got a few other accolades as well. And also one of our apprentices won Apprentice of the Year 2 years ago as well. So we're really proud of the awards that we have, and that all comes down to the staff that we have at Swift, but also our learners and the employers that we work with. We only work with employers who are going to give you the best experience in early years. So we cherry pick them based on their Ofsted and our own auditing as well. The next paragraph does actually say we only work with learners across London, West Midlands and East Midlands, but since this has been done, we have grown. So we are able to provide apprenticeships and diplomas in the Midlands, so East and West, London, Manchester, Liverpool and Leeds. So our training is led by experienced childcare practitioners, so people that have walked the walk. So these are people that really understand what they're talking about. They're not just reading it from a PowerPoint or a book. They've had lived experience. And all of our curriculum and our programs have that embedded. So we have some of our tutors who have had experience working in hospital-based nurseries. We've had playgroups, nursery owners, all different walks of life, teaching assistants and so on. And they come in and they teach from their own experience, which is something that you should also consider during the call today. Is you may not have thought what happens post nursery. Your career pathway, you may be focusing on just where you can develop within the nursery, rightly so. But there's also a career pathway outside of nurseries down the assessing and tutor route. So for me, when I started Swift 10 years ago, I left the early years industry, but didn't want to kind of waste all that knowledge and passion and great times. I just didn't want it to end. So I always chose to then come into assessing because I can continue it and I can pass it on. And I think also it's really good to consider that when you get to that level of you want to look for something new, don't forget that assessing and teaching is there, where you can carry on that passion. And for 10 years, I've been able to kind of pass that on to whether it's staff or directly with learners, and it's been great. So with Swift, you'll gain real skills. And for us, our offer is predominantly based around the level 3 early years educator. So we have 2 different pathways for it. Well, 3 technically. We have the apprenticeship route, which is through apprenticeship funding. And that will help you get the training and the employment at a free of charge for you guys on the apprenticeship. But we also then offer the early years level 3 on a commercialized course, which is where you can pay for the actual qualification, which you pay £300 a month for 10 months. You and your employer can contribute. And that option is really for somebody who may be more mature and doesn't want the apprenticeship route, but also for people who are coming and they're looking for training from abroad. So they may not be eligible for apprenticeship funding. So we have the kind of core programs that we're able to support with. And from there, from the apprenticeship route, you can obviously then go into university, which obviously we've just heard some wonderful stuff about the university routes, but you also can go into full-time employment as well. So if we move on then to the kind of benefits of why we should look at a Swift apprenticeship and why an apprenticeship overall. So when you start your apprenticeship, I don't know if there's some of you that are on apprenticeship or considering it, you're able to earn whilst learn, which is obviously the big selling point of apprenticeships. But from a employer's perspective, and what you can provide as an apprentice is a fresh pair of eyes, so bringing in new ideas and concepts. You can, as we said, gain that qualification and the knowledge with a hands-on approach. So some of you may prefer to learn whilst doing the job. So rather than just reading and listening and literature and various other assessment methods, you can actually go and explore it, and you can go and learn through, just like we explore children learning through play, you can go and learn through actually doing the role as well. You'll also have one-to-one support and guidance to help with your personal and professional development. And the way that our programs are built, we have the core principles, but then we also have additional areas outside of the main curriculum as well. So we understand there are more areas around safeguarding, health and safety and personal development that we can build upon. And for us, the final point on 6 is that you can then use them connections and that learning within the early years sector and start that evolution. So one thing, whether you're considering apprenticeships, university or any other kind of avenue, my huge advice to anybody who's going into early years or already in early years is to avoid becoming a carbon copy of the standard. So obviously you have units, you have criteria, knowledge, skills and behaviours. You have all of that you have to follow and you have to achieve in order to qualify. But for me, it's really important that you take lots of different theoretical perspectives on board and you become your own educator in your own right. We don't expect every child to be exactly the same when we teach them. And you need to consider that for yourselves too. And what educator do you really want to become? So taking influence on different pedagogies, different experiences. There's hundreds of different students in here with hundreds of different experiences. So learn from each other as well. Have that little network between you, and hopefully more sessions like this will help kind of build that network. So as I said, there's different students on here. Some of you are already in the industry, so you know what to expect. Some of you may not. So I'm just going to quickly fly through the next 2 slides. But as you may or may not know, a job in childcare in early years is extremely rewarding. No day is ever the same, and you do make a difference from the day you begin. I'm a huge believer in generational impact, which I'll come on to that later on in a later slide. But you're going in there as an educator, and this is where we need to raise the profile for early years, because you are a teacher, you are an educator, and you're starting that development. You're creating that first initial step. So you are responsible for building the foundations of that child. And I think it's really important that you give yourself credit for what you are about to go into, because there are misconceptions sometimes in the early years industry, which we're all actively working hard to kind of challenge. But for you, you are there and you are sometimes that child's main carer to some extent. You've got them for the majority of the hours in that day. And they are looking at you for inspiration. They're looking at you for some support. And again, that's where, going back to my previous point of what educator are you going to be, that's where you get to shape the future. And I know it's very cliche, but these are the future kind of lawyers, solicitors, prime ministers. You know, these are you're the starting, and you're the starting point. So we do have some questions there on the slide as well that you can read, but it's more around, you know, obviously what can you wear. Again, I'm a true believer in you present yourself how you want to be seen. So, you know, obviously, by the end of the day, whatever you wear is going to be covered in potentially snot and arts and craft and paint and whatever else. But I think if you go in there and you look professional, you will then be seen as a professional and you will then act that way as well. And just from the apprenticeship side, majority of the working hours are between 30 and 40 hours, and so on. So if we move on to the next slide, please, Janet. So a day in the life of, we've just put a normal day in the life slide in here, and we actually got one of our apprentices to fill this out from what she goes through. So children usually arrive between 7 and 9, and she went in straight away with the breakfast offer. And again, when we're talking about giving children breakfast, how can we turn that into a learning opportunity? And we need to see things through the eyes of that child. So when it comes to breakfast, the apprentice was focused on giving them choice, allowing them to cut up their own fruit, allowing them to talk about oral health and how to make sure that they're eating right and having a balanced diet. And suddenly that became a learning exercise as well as a social exercise. Then we went on and we spoke about practitioners and the chat to caregivers. So the handover between parents and or carers and the educator. And again, that's a very good personal skill because we often forget that as well. But having these conversations with our parents allows us to enhance our speaking, listening, and communication. And I know there's a lot of our apprentices sometimes struggle with anxiety, and having them handovers actually allowed them to develop the confidence to talk to new people. Then they went straight into kind of the welcome, the song, self-registration, followed by kind of gentle activities, so your puzzles, your books, building blocks, helping children to settle in. And some of you may already be doing this, and some of you this may be new information, but at this point the apprentice really thought about the group of children that they were working with. So what are their interests? What do they like? What's going to entice them? What's their next steps? And then I spoke to the apprentice about this, and she was telling me about the assessment cycle that she followed. And suddenly all this passion just exuded from her. And she was talking about how she'd identified the child liked Paw Patrol. And she made this activity around counting Paw Patrols, talking about size differences. And suddenly this child was hitting all of their next steps that the other practitioner had struggled with for quite a while. And we had a conversation around good and bad practice. And good practice is identifying what that child needs, and good practice in finding a way to make that happen. And then we spoke about the kind of adult-led activities that she went on to and the child-led activities, and mixing that up and letting the children lead, but then also having adult-led activities for trying to enhance kind of their language and the harder points of their next steps as well. And just while we're talking around next steps, and some of you will be doing observations already of children and assessments and creating kind of next steps and looking at the EYFS criterion. And again, what I think we really need to kind of enhance in early years is the use of characteristics of effective learning. So that is the first part of the EYFS. If you've seen it, great. If you haven't, let us know in the chat and we can send you the location for the updated EYFS. But the characteristics of effective learning is really beneficial for every child, firstly, but also for children who have neurodiversity, because they may not follow the typical normalities of expected patterns in the EYFS, but suddenly you start looking at the characteristics of effective learning, and suddenly you start seeing these children develop, and you're seeing them progress in areas that weren't previously considered. So again, I won't go too much into that, but if you haven't already familiarized yourself with the characteristics of effective learning, then you really, really should, especially for your neurodivergent children as well. So then after that, at the end of the day, she ended the day on some outdoor play. She got them to kind of blow off some steam outdoors. And I spoke to her about what that was. And I used to get really sick when I used to manage a preschool room. I used to get bored of the same resources every time I opened the doors. Maybe there was a balance beam, maybe there was the odd water tray. But she had a full planting station, and they were planting seeds and they were watching it grow, and they were talking about how the plants grow. And I spoke to the learner because it was a missed opportunity, and there was a plant that was decaying. It was dying. They hadn't looked after it enough. And one of the children started talking about kind of life and death, and the apprentice actually kind of stopped the conversation. But it was a missed opportunity of actually teaching them something that happens in life, unfortunately, but through plants. And we started talking about that, and she then went back and revisited the activity, and she had fantastic feedback from the parents and carers about how that helped that child understand from a nice perspective. So what I wanted to kind of get across with this point is, although we've got a typical day in the life morning routine here, not every day is the same, but in every day there are some fantastic learning opportunities. So the child at the center of your practice is essential, and making sure that you can identify various learning opportunities is really what you want to do in order to be a exemplary educator. Thank you, Janet.
Thank you.
If we just skip this one, that would be great. So it just goes on about lunchtime and afternoon, but the same message.
Okay, and these slides will be shared and available on the presentation, so you can really reflect on some of those things that Jack has said when you're looking at that particular slide. Oh, this is exciting. Thanks, Jack.
Yeah, brilliant. So it is exciting, and it's one of my favourite topics. Early years, then men in early years. So I started working in early years, as I said, well, I've been at Swift for 10 years, but prior to that I had 5 years in early years education. So I left sixth form, went straight into early years. I worked with SEN. I was a room leader. I was a wraparound manager as well. And at that time, I remember just being surrounded by female employees. And it was all good. It was fine. And then we had an auditor come in, and she said to me, and it still stuck with me. She was like, "You are one of 2 male educators in your entire county." Now, I never lived in a small county. And that was the first point where I suddenly thought, okay, well, this is obviously not the norm. And then I had a parent that came in and spoke to the manager, and he basically turned around and said, "I don't want Jack changing nappies." And the manager went back and said, "Well, can you have some clarification as to why you think that?" And it was purely because of the gender, which has no kind of back stats or data that proves that men are more of a danger. In fact, if you look at serious case reviews, it's quite the opposite. But either way, his whole viewpoint of me looking after his children had changed because of my agenda. So when I came into Swift, my aim was to kind of change that stigma, raise the profile, talk about it. And Janet will tell you, I don't stop talking about it. And just encourage more men to join and talk about that generational impact. And that's what I'm going to do today, just kind of give you an insight as to where we're at with men in early years. So we're aware of the new government initiative to encourage more men to work. I think it's needed, obviously, and more people raising that awareness is great, and any initiatives to get men to join early years is obviously welcome to us too. We're pleased to see it. We've been working closely with MCTJ, which is male childcare and teaching jobs, and we were one of the very first to kind of join their movement, because we believe it's important for children to see diversity in the people who teach and guide them. And we will continue to strive for a more gender diverse workforce in the early years sector. It's my aim is, by the time I'm really old and hopefully retired, that I don't need to talk about this anymore, because it's no longer an issue, it's a mute issue. For me, there is no role that is gender specific. So in one of my other businesses that I'm a part of, it's engineering, and they have the opposite. So they don't have enough females joining because they feel it's a male dominated, and there is this stigma attached to it. And there is so many questions that come up for a male educator. You know, I had a conversation not so long ago with a group of school dads, and one of them said to me, "You know, I would love to work in early years, but I just can't." I said, "What do you mean you can't?" And I thought he was going to say something around like a DBS or anything like that. He was like, "Well, I can't because it's not a man's job." Well, you can imagine the response at that point. You know, there isn't a man's job, there isn't a female's job, and as long as you're passionate and as long as you're dedicated, that's all that matters. And in regards to professional status, you're changing lives. So I didn't know changing lives was just relevant to male or female. So we had this whole conversation. He hasn't yet joined our apprenticeship program, but I've offered it to him. But we will see. So for us, what we want to make sure is that we are raising that profile, which then if we go on to the next slide, we'll see some stats around where we're at the minute. So across the UK, men account for only 3% of the early years workforce, yet 9 in 10 parents believe it's important for children to be cared for by both men and women. So where I mentioned generational impact earlier, this is where this starts to come in. So children benefit massively from a diverse workforce. So we need to remove that stigma. So if we start having more male educators now, the children that are in the nursery will then start to see male educators as the norm. So they don't see it as oh my God, there's a man in early years, because they were taught by a male in early years. And we start to have that generational impact, and suddenly boys become men who are confident to pick a career that they want to do, not one that they feel society tells them that they have to do. But also that it's not questioning their sexuality or their reasonings. It's just because they want to work in early years. And for me, it's 2025. I can't believe we're still having these conversations, but we are. But the more people that can help support this, the better. So you have two camps of people. You have people like myself who are male and worked in early years and can talk about lived experiences. But you've also then got all the many female early years educators who can talk from an advocate perspective. And that's about supporting the men and going, you know what, we hear you, we see you, we value you, and we know you've got a place in this industry, and we're going to support this, and we're going to talk about early years being a career. That's it, full stop. Not a career for, just a career. So that's kind of where we want to get to. So then if we move on to the next one, for us to support, if you're a man considering a career in early years, get in touch. That's not to sell a program to you. That's because we have a whole network. So we appreciate that, like when I started out, there was me and one other in the whole county, that there is limited people out there that you can talk to and you can relate to from another male's perspective. So we have a network set up where you can talk to people like you who you may go, and unfortunately we still hear it through our apprentices sometimes, where parents have said things like what I experienced about the nappies, and we get to kind of talk as a group and go, you know what, you're not alone. So if you are considering, get in touch for the network support, but also don't let that stigma hold you back. So be a part of something special, something meaningful, and have a positive impact on that future generation. And as you've heard, the career pathways can take you down many routes, but you've got to love what you do. So if you can join the industry and you can pass on your passion and dedication, great. So if we can support in any way, or if there's anyone on here that wants to become an advocate for more males, please let us know. and we can definitely help you out. And I think is that it, Janet?
Let's just check. We've got just contact details there, really, Jack.
So you've got all our contact details on there. So if you want to contact us, our socials are there. We've also got some helpful links, and we've got Amy, who is our intake consultant. On the left-hand side, you've got something called the Swift Way. That's our ethos, that's our culture. So that's what you will expect from us, and in turn, we would expect from you if you work with us. So we want a supportive network and teamwork. Hopefully, you've seen that over the last couple of slides. We're focused on our welfare and your welfare, so we make sure that your learning is sequential and all purposeful. So we go through the kind of stepping stones of the qualification. We want to make sure we have a positive impact on your career, but also you to have a positive impact on the wider industry and your local area. We're focused on you succeeding, and we have trust in you and what you can do, and vice versa. So yeah, that's Swift. I think you'll have the PowerPoints for all the links and stuff on anyway, but feel free to get in touch and just mention this webinar, and we'll know where you've come from.
That's amazing, Jack. Thank you so much. And just before I go back to Angie to sort of look if there's anything in the chat, I've just written a few things down that, and they're not necessarily questions at all. They're just observations that have really struck a chord, really, in terms of, why we continue to have this gender battle, if you like, or challenge. We've managed to overcome it. And it was the same with nursing, I think. And not that long ago, when and it's probably still more dominated by women, but it's not seen as something that males do not do. It is now very open across gender, which is fantastic. So that gives me a little bit of hope. And I also think, I'm of a certain age, I guess, but when I think back, there were very few male primary school teachers. It was it was odd, if you like, or different, and yet it was a lovely experience to be taught. It was different, and it just brought something special. So I think what males in childcare can offer is fantastic. And then just for reminding us about the importance of that unique child, the holistic child, thinking about those characteristics of effective teaching and learning and how that can be applied to all children. And you mentioned children neurodiverse, or children with special educational needs and disability, and how we actually tune into individual needs. And then the last thing I wrote down, I'm going backwards, obviously, in my notes here, but the importance of relationships and connections, which again has been emphasised all the way through the presentation so far this morning, and the further opportunities for assessing and teaching, and the fact that, this is not an occupation that has closed doors. This is an opportunity. No. It's an occupation that opens up many doors on many different diverse levels and areas. And so I guess the students that are studying on early years childcare, whether that's teaching assistant or whether that's early years education and care, this really is a foundation that you will springboard from, and that has got so many opportunities. And those opportunities and experiences should be available to across those genders. That we need to change that narrative, and I know you and I have talked about that many times, so I don't want us to get too carried away down that road again, but it's also important. And so, Jack, thank you for sharing everything about Swift and what the wonderful things that you do, and for also reminding us of the importance of advocating for childcare for early years, and that cuts across gender. And so fantastic to hear from you this morning. Thank you very much, Jack.
Thank you.
Okay. I'm very happy.
Before we move on, Janet,
sorry. Yes, Angie, I said I'd come back. I got carried away.
Because I don't want to miss this opportunity for you to hear the comments that have been going in the chat.
Yes.
Because yeah, inspirational. Thank you. I love the swift way, by the way. That's really
Thank you.
Nice,
brilliant.
isn't it?
That. So just very quickly, that I think one thing that I can take away from this personally is the really good advice about being your own educator. And this is something that I talk about, and Janet and myself talk about a lot, is for all of the experiences that we bring, we are individuals that can bring so much to our children and young people. So I love that. Be your own educator. I'm going to take that away with me today. So thank you for that. One of the shockers, obviously the 3%, and we need more people like yourselves to be those advocates. So, but Winston from the chat has been inspired by you, and he's going forth, and Winston, we want to hear more about your journey, please. So he's been inspired, Jack, and I just wanted you to know that.
Oh, brilliant.
That's
it. You know, if we can do more things like this, you know, that's one that said it, you know, and we start to make the difference. So yeah, Winston, get in touch, and we'll definitely be able to help you out from the male childcare and teaching jobs network as well.
Brilliant, thank you.
Oh, fantastic. Okay, any more questions or thoughts from yourself or in the chat, Angie?
Sorry, I just poodled off then, didn't I? No, just lots of praise, Jack. Really interested. I think now that you've put your details on there, many people wanting to know where you were based. And I said, you just get in touch wherever you are. It doesn't matter where you are. Just get in touch, and you'll be able to offer advice and guidance. So yeah, it's brilliant.
Absolutely. Thank you, everyone.
Thank you. Okay, so Karen, apologies. So now I want to introduce Karen to you. Karen is our CEO for Montessori Global Education, with over 20 years of experience in the education sector, supporting charitable non-government organisations, so charitable organisations and commercial initiatives, both in the UK and internationally. Focused on achieving high quality, sustainable educational outcomes across diverse learning environments. Of course, as you can absolutely resonate with, Karen is passionate about promoting Montessori education, and I know that that is an absolute fact, as an accessible and inclusive pedagogy, the way to deliver a curriculum that benefits all learners. And Karen advocates strongly for Montessori principles that enhance children's thinking capacity, self-confidence, and resilience in facing challenges. And those things are so important, aren't they? The ability to think for ourselves, the confidence to be able to have a go at something, and to understand that actually not everything might go to plan. So how do I problem solve? How do I develop that resilience? Karen remains actively involved in programme delivery and assessment, valuing hands-on practical experience to stay aligned with learners' evolving needs. Karen, welcome to the conference. Thank you so much for sharing your thoughts with us today.
Thank you very much for that introduction. That's really, really kind of you. I'm thrilled to be following Jack, who said absolutely the key of the day, didn't he? That educators should be their own person, their own educator, because that's what we want for children.
Absolutely.
Hey, welcome everybody. My session is clearly focused on Montessori, but I hope that by the end of the session, I might have sparked something of an interest in pedagogy generally for many of you in the audience as well, and that would be a success regardless. I am an advocate for Montessori, but primarily foremost, I am an advocate for children, an advocate for making sure that children have the best possible educational experience that we can all offer to them and support them with. Thank you, Janet. Okay, so we are Montessori. We're Montessori Global Education. The clue is in the title. We work across the world, but we have a long-standing legacy. So our history dates right the way back to original teachings from Dr. Maria Montessori herself. Over 75 years of experience, hopefully give us some sense of the evolving situation